At that same shelter, the scramble is on to place 80 homeless people into new housing before a March deadline.
News 13's Jennifer Emmert found more than a quarter have qualified for housing vouchers, but finding permanent housing is proving difficult.
For 8 months, as many as 80 residents have called the Ramada Inn home. Come March, that could change. For some, that change is coming sooner.
Me and my wife both has had some challenges in life. We've been through some things that I'm not proud to speak on.
Despite those challenges, Tony and Lisa Edwards prayed for a change after 4 years on Asheville streets. The Ramada gave them that.
It was a blessing. Oh my God! I mean, you know, that was a blessing from heaven.
They wash our clothes. A lot of times they give us food. We get a place to sleep at night. We get a place to take showers.
Ashley Lung, Sunrise's shelter director, has been tracking the program's impact and progress. 90% now have a birth certificate, social security card, or ID.
We have about 12 folks who have went and got on medicated assisted treatment. So yes, you know, they have a substance use disorder.
8 have gone into transitional or permanent housing, and 22 qualified for housing vouchers.
They've been given a voucher. They've been connected with services, with the case manager, with maybe Homeward Bound for this voucher, but we don't have an affordable housing unit to put them in.
And so they wait, worried time is running out.
It's just been great to watch these folks grow. They would have never probably sought any of this without the foundation that they're standing on right now. And just to think that at the end of March, that foundation is gone.
Knowing in Asheville's difficult housing market, time is not on their side.
It could take some folks 18 months to 24 months to get into a permanent housing unit.
Tony and Lisa qualified shortly after entering.
I'm thinking in my mind that things are going to happen overnight real quickly, like, you know. So there was times where we got a little bit impatient.
Approval of their dog is the final key to a new place and a fresh start in the new year. What will it mean to get into your own apartments?
It'll be great.
It's been a few years since I've house kept. It's been a few years since she's been able to housekeep as well. Yeah. So it's going to be a blessing.
You can find more information on the resources provided to residents on our website at WLOS.com.
Another Asheville homeless encampment is raising safety and health concerns for homeowners who live near it.
The encampment is across from the River Arts District on a ridge below Riverview Drive in West Asheville. News 13's Kimberly King has more.
I'm standing on the main roundabout in the River Arts District, and the homeless encampment can be seen on the ridge behind me along a white fence line. We have confirmed that Duke Energy is actually leasing the property to the city of Asheville. The complexities of handling the issue of homelessness involves for city leaders not only the people in the camp, but also in this case, the people living along Riverview Drive.
This is the way that I go in and out.
Homeowner Corey Marcone takes us down the trail to the encampment along the ridge.
See all the trash. There's another big trash pile over on the other side, and then in between are all the tents. It's started to accelerate in terms of just how many camps are concentrated at the top of the cliff. There was a fire about a week ago.
Marcone is most concerned about trash that now sits above the French Broad. He says police have been doing a good job.
I saw 2 kind of undercover guys come in here and arrest somebody, but it was all very peaceful.
But other residents along Riverview Drive off camera tell News 13 they're worried about safety for their children with their properties adjacent to the site. One man living at the camp for nearly a year spoke with us off camera. Is it hard living out here?
At times. Sometimes it's not.
The man who grew up in Asheville acknowledges trash is a problem, but says he's concerned about what he's seeing citywide with the crisis. He feels the city, dependent on tourism, isn't doing enough to address root causes of homelessness.
This is a problem that they would like to sweep under the rug versus, you know, helping people take care of the situation, in my personal opinion.
A city spokeswoman says staff have asked residents to move and done outreach, but so far they have stayed.
President Biden's new COVID-19 winter plan presented today. We talk with local health experts about what you need to do going into the Christmas and New Year's holidays.
News 13's Andrew James has our local COVID outlook and recommendations from the medical community.
After leveling off, COVID cases in Buncombe County are once again increasing, and it's not just case numbers. According to the Buncombe County Public Health Department, hospitalizations are also headed in the wrong direction.
The advice fundamentally hasn't changed.
Dr. William Hathaway, Chief Medical Officer for Mission Health, with an all too familiar message as we quickly approach the Christmas and New Year's holidays. Get vaccinated, and when you're eligible, make sure you get your booster shot.
Practice good social hygiene, social distancing, wear a mask when you're in public, stay away from people, and wash your hands as much as you possibly can.
Dr. Hathaway says this time last year, we saw a significant rise with the surge from Thanksgiving through New Year's.
We have seen a rise in cases this year, but it hasn't been as steep or as many patients. And I think that's in large part because a year ago we didn't have vaccines for people.
I asked Dr. Hathaway how the hospital is handling this latest surge with the Omicron variant. He says they are capable of handling the numbers right now, but he still has concerns.
Because we could end up in a situation where we have more staff shortages compromising care than we are overwhelmed by patients. But it's that constant supply demand of staff and patients and how we balance those ratios.
President Joe Biden announced Tuesday that the federal government will purchase $1.5 billion at-home rapid tests with free shipment to Americans.
Do you think that will have an impact for this holiday season?
It's a tough prediction to make. Clearly, if people have access and they can test and identify illness early, then they can isolate, and we should see a decline in spread of disease.
Dr. Hathaway stressed to me that as you prepare to celebrate with friends and family, that you should find ways to do so safely to help stop the spread and the strain on our local healthcare system.